our discussion. And today our discussion is going to be around how do I help my recovering addict or alcoholic? So how can I, as the family member or loved one, help the person that is currently in recovery for addiction? Okay. Okay, so firstly, I would just like to acknowledge that living with an addict can be incredibly challenging. Often it results in a strained relationship, false hopes of the rehab as a quick fix, and the understanding that recovery is a lifelong journey. So when we think about strained relationships, living with someone that's very close to you that is an addict, the relationship is often characterized by distrust or resentment, or there's communication breakdowns. Addictive behavior can cause emotional turmoil within the family, leading to arguments, conflicts, and feelings of isolation. Secondly, there's often this misconception that rehab or treatment will magically cure the addiction and solve all associated problems. While treatment can be an essential step in the recovery process, it is not a quick fix, and it is important to note that relapse is common. And then lastly, recovery is a lifelong process. It's a lifelong journey. Recovery from an addiction, as I just mentioned, is a lifelong process that requires ongoing efforts, commitment, and support. It's not just a one-time event, but rather this journey of personal growth and healing and self-discovery. So by saying that this topic of tonight can be quite a sensitive topic, because as I just mentioned, there's strained relationships. Loved ones we have this hope that rehab is going to fix everything, and hoping it's just a one-time off thing and things will be better. However, I do encourage that you, as the family members or the loved ones, try to support your loved ones in rehab or in the recovery process, although it might be hard. So tonight I'm going to share a few ways and recommendations that you can apply when it comes to supporting your loved one. Okay, so firstly, it is very important to educate yourself on the addiction and the recovery. So let's start about what is addiction. So the disease of addiction it's a complex brain disorder that is characterized by this compulsive drug or alcohol use despite harmful consequences. So by stating that your loved ones, the people, the addicts, they know that it has consequences. It is causing harm. It is harmful to them. However, they still use the drug. So that is what we mean about the disease of addiction. A lot of the time when we talk to or work with the people in rehab, we say that you're not just an addict, but you're an alcoholic as well. So the disease of addiction, saying that, yeah, you're clean from alcohol now, but you can't use any other substances afterwards. So I hope that makes sense what I'm trying to explain, that it's a disease of addiction. It's not just we're fighting alcoholism or the other substances that can be used. So why it is important to understand addiction is because it helps the family to empathize with their loved ones struggling and avoiding the stigmatizing attitudes. Okay. Secondly, I'm not sure if you guys heard about the big book. So it's a big blue book that is the Alcohol Anonymous book. And specifically in the big book, I would like to emphasize the chapter on the doctor's opinion, and how it can be relevant for the families and helpful for the families. So firstly, reading the doctor's opinion, once again, it helps you understand alcoholism as a disease. So in the big book of Alcohol Anonymous, they speak about alcohol, but this can apply to all behaviors or addictions, not just alcohol. So this can apply to your loved one if they use other substances as well. Okay, so in the doctor's opinion, it provides value insight into alcoholism as a disease, rather than a moral failing or a lack of willpower. By understanding that alcoholism is a mental condition, families can approach their loved ones' addiction with greater empathy, compassion, and understanding. Secondly, what this chapter helps with is it helps recognize the progressive nature of alcoholism. So this chapter explains how alcoholism is a progressive condition that worsens over time if left untreated. This can help you guys as family or loved ones recognize the severity of their loved one's addiction and understand why interventions are necessary. Thirdly, what this chapter also helps with is acceptance of powerlessness. So in the doctor's opinion, it highlights the concept of powerlessness over alcohol for both the alcoholic but also their loved ones. This can help families let go of the belief that they can control or cure their loved one's addiction on their own, and instead focus on supporting them in seeking help and treatment. Then another way how the chapter can help the family is the importance of seeking help. So this chapter emphasized the importance of seeking professional help for alcoholism or addiction. Families can be encouraged to support their loved ones in assessing treatment, therapy, or support groups like Alcohol Anonymous or Narcotics Anonymous or Gambling Anonymous. And then lastly, it helps with providing hope for recovery. So while the doctor's opinion acknowledges the challenges of alcoholism, it also offers hope for recovery. Families can be reassured that with the right support, treatment, and willingness to change, their loved ones can overcome alcoholism and rebuild their lives. So overall, the doctor's opinion can help you as family or loved one gain a deeper understanding of addiction as a disease, accept that their own powerlessness over it, and find hope for their loved one's recovery. So it can serve as a source of guidance and encouragement. And then lastly, when it comes to codependency, I would recommend the book by Melody Beatty, Codependent No More. And why this book is incredibly helpful for families is by understanding codependency. So in this book, Beatty provides a comprehensive explanation of codependency, helping family members recognize codependent behaviors and patterns within themselves. By understanding how codependency manifests, it impacts it has on the relationships. Family can be able to address and change the unhealthy dynamics that's forming or formed. In the book, they also speak about setting boundaries. So they emphasize the importance of setting and maintaining healthy boundaries in relationship. And this is particularly relevant for families or loved ones of addicts who may struggle with boundaries due to enabling behaviors or desire to control their loved one's addiction. They also talk in this book about detachment and the concept of detachment, which involves letting go of attempts to control or fix the addict's behavior. This can be empowering for you as a family member who feel overwhelmed by their loved one's addiction, and help them focus on their own growth and recovery. And then one other thing I would like to emphasize in this book specifically, although there's many things this book teach family members or loved ones, is accepting and forgiveness. So in Codependent No More, it encouraged the reader to practice acceptance of themselves and their loved ones by letting go of the resentment and forgiving past hurts. Family members can begin to heal and rebuild relationships in a more healthier way. So overall, the Codependent No More book offers practical tools, insights, and guidance for families of addicts to break free from codependent patterns, establish healthier boundaries, prioritize self-care, and find support of their own journey towards healing and recovery. So you see, I asked the question, what does treatment look like? So it's very important and actually crucial for families to know the treatment plan and how the treatment plan looked for their loved ones in rehab for several reasons, actually. So firstly, it's to understand the recovery process. So knowing the treatment plan helps families understand what their loved ones will be going through during the time that they are in rehab. This includes the various therapies, activities, interventions that will be part of their daily routine. By understanding that structure of the program can alleviate anxiety and uncertainty about what to expect. By knowing how the treatment plan looks, also help support the recovery journey. So when the family is involved and support can significantly impact the success of a loved one's recovery. By understanding the treatment plan, the family can offer informed encouragement and assistance. They can reinforce the skills and strategies that were learned in rehab, provide emotional support during challenging times, and help implement healthy habits and a routine for when their loved ones do return home. It also helps with addressing concerns and expectations. So families may have specific concerns and expectations regarding their loved one's treatment. Knowing the details of the treatment plan allow families to address these concerns and discuss any questions or uncertainties with the rehab staff. So with the counselors of your loved one if they are still currently in rehab. This open communication can help build trust and collaboration between the families and the treatment team. And then it also helps with preparing for transition. So understanding the treatment plan can help you as a family or loved one prepare for the transition, such as at the end of their residential treatment or rehab or secondary care, when they have to come back home or to go to a lower level of care. Families can work with the treatment team to develop a plan for ongoing support, aftercare services, relapse prevention strategies to help their loved ones maintain sobriety and continue their recovery journey post-rehab. So in summary, knowing the treatment plan of your loved one in rehab empowers the family to actively participate in the recovery process. It provides support, address concerns, prepare for transitions, and promote healing for both the individual in treatment, but also the families in a whole. Okay, another way that I would recommend that you can help your loved one during their recovery journey is to make changes to support their sobriety. So changes that I would recommend and why it is important is because establishing the supporting home environment do create a safe and maybe a drug-free space at home, free from triggers and temptations. So examples that I would give is maybe to remove the alcohol or drugs from the house, and encourage them to participate in more positive activities. Maybe avoid social gatherings where you know there will be substance use or abuse. And then encourage your loved one to build relationship with sober friends. So many times what we see during treatment is your family, the individual being anxious about, okay, but what happens next? Like, I met these friends, I made these friends, but they are also the friends that encourage me to use my drug of choice. So by supporting them and helping them find ways to other ways to enjoy themselves and helping them build new relationship with other types of friends will also alleviate that anxious feeling that they might. Or can I go on? Okay. Can we quickly go on back, please? Thank you. So this ties in with the previous slide where we spoke about making changes in the house to support sobriety, is to also encourage your loved one and promote healthy lifestyle changes. So by promoting healthy lifestyle changes, after your loved one has been in rehab is important for numerous reasons. So firstly, it is to support long-term recovery. So healthy lifestyle changes such as regular exercise, balanced nutrition, adequate sleep and stress management, support overall their well-being can help them significantly and contribute significantly to their long-term recovery. These behaviors promote physical health, mental clarity, emotional stability, and resilience, all of which are essential for maintaining sobriety at the end of the day. Also helps address the underlying co-occurs with other. Sorry,
you are breaking up.
Okay.
Yeah, voice is distorted. So please check your connection.
Okay. It seems fine on my side.
Seems to be getting better.
Let's see. It seems to be fine on my side. How does it sound, Cheryl?
Sounding
Can you hear
better.
Me?
Yeah.
Okay. Okay. Please just stop me again if you can't hear me.
Will do.
So as I mentioned, like Okay, thank you, Cheryl. So addressing this underlying issues, so as I just mentioned, so substance abuse often co-occurs with other health problems or imbalances, such as poor nutrition, lack of exercise, untreated health issues. So by promoting healthy lifestyle changes, families can address these underlying issues and provide a more holistic support for their loved ones' recovery at the end of the day. It also reduces triggers and cravings. So what that essentially means is engaging in healthy activities and behaviors can help keep them distracted from triggers and cravings associated with their addiction. Exercise in particular has been shown to release endorphins and reduce stress, anxiety, and depression, all of which can be triggers for relapse. Okay, then we go to relapse destructive habits. So encouraging a healthy lifestyle change provides positive alternatives to the destructive habits and behaviors associated with addiction. Instead of turning to drugs or alcohol to cope with stress or boredom, your loved one can lean to rely on healthier coping mechanisms and activities. And it helps strengthen relationships. So engaging in health and create positive shared experience, cooking meals together, activities, promoting healthy lifestyle changes, fosters the connection and support within the unit. Okay, so overall, promoting healthy lifestyle changes after rehab reinforces the lessons learned in treatment, providing ongoing support for recovery and helps your loved one build a foundation for a fulfilling sober life. Cheryl, can you still hear me?
Yeah, we can hear you, Marlé.
Yeah. Okay, thank you. Just want to make sure before I continue. Then this one is quite important. So you as a family member or family or loved one, you need to set healthy, realistic boundaries. So a boundary is this imaginary line that separates oneself from another. Physical space, emotions, needs, and responsibilities from aware of how they should treat you and what is acceptable and what is not acceptable. The reason why boundaries is so important is you need to set these boundaries with your loved one to protect yourself and to maintain your own well-being. So avoid enabling behaviors that might indefinitely support their addiction. So for example, refuse to lend them money or set the boundary to not lend them money to cover up their mistakes or bail them out of consequences related to their addiction. Or if your loved one breaks a rule or relapse, it's important to enforce a consequence consistently, such as limiting contact. Sorry, you can see us at the end of the day, and maybe go and seek professional help. Maybe we can go to the next slide. Okay, then encouraging them to follow all treatment recommendations. So encourage your loved one to seek professional help and participate in treatment programs, their therapy or support groups offer to help them research treatment options and accompany them to appointments if needed. So for example, help them find a reputable rehab facility, therapist, or support group in their area. Maybe offer to assist them with transportation, or if they have children, to help them with childcare arrangements when necessary. So encourage them to constantly go to meetings, especially after they've been in rehab. Okay, and then this is quite what I meant in the beginning about a sensitive topic and a hard one that you as family might experience because of all the hurt you feel towards the addictive behavior that your loved one has caused. But it is also very extremely important from you as a family to provide emotional support. So be a source of encouragement, empathy and understanding for your loved one. Let them know that you believe in their abilities to recover and that you are there for them, even during difficult times. So try to be empathetic and non-judgmental. Show compassion towards your loved one's challenges without blaming or criticizing them. Another recommendation is to listen to them, so practicing active listening. So encourage open communication and provide a safe space for your loved one to express their feelings and concerns. It's like this. Imagine if you were in or if you were going through a tough time, you'd want someone to listen to you without judging, right? A compassionate ear and a caring heart. Okay, we can go to the next slide. Okay, and then lastly, this is more for you guys, but this whole support that you need to provide to your family member can be quite draining, and it can become a full-time job. So self-care is highly critical and extremely important. So by practicing self-care is crucial for you as a family member to maintain your own well-being and effectively support your loved one. We usually say you can't pour from an empty cup. So your well-being needs to be in a good place for you to be able to support your loved one. So recommendations I would make there is to seek help. Connect with others who understand what you're going through by maybe attending support groups such as Alon, Naran, or Coda. That is just a few support groups I would mention. Sharing experiences, receiving immensely helpful. Alateen and Alachat is also other support groups that can be helpful, but since COVID, a lot of these groups have closed down. So I would recommend that you just go onto Alcoholic Anonymous website to see what support groups are currently active. Practice stress reduction techniques. Engage in activities that can help you manage stress and promote relaxation, such as meditation, deep breathing exercises, maybe yoga or mindfulness practices. Taking time for self-reflection or self-soothing activities can help you cope with the challenges of living with an addict. Maintain healthy boundaries. Once again, boundaries play a very big role. So recognizing the importance of maintaining boundaries in all areas of your life, not just when it comes to your loved one you need to support, or struggling with addiction. So limits with
You're
work,
breaking a bit,
social
Marlé.
commitments, and other relationships to prevent burnout. Okay. Okay, let me see if, sorry guys. Can you hear me better now, Ellie?
Yeah, it's better now.
Okay, I apologize for the connection. Okay, then take breaks. It's okay to take breaks from the situation when needed. So whether it is a short walk outside or a weekend getaway, or simply setting aside time for yourself each day, carving out moments can recharge you, your energy and perspectives. Another one is to engage in activities that you enjoy as an individual. So make time for activities and hobbies that bring you joy and fulfillment, whether it's exercise, reading, or spending time with your own interests and passions. It can boost your mood and your resilience. Seek professional help. Don't hesitate to seek support from a therapist or counselor who specializes in addiction and family dynamics. Therapy it can help you gain coping strategies and explore ways for you to enhance your well-being. And then lastly, practice self-compassion. So be gentle and kind to yourself as you navigate these challenges of supporting a loved one during their recovery or with addiction. Acknowledge your efforts and strengths and recognize that it's okay to ask for help when needed. So by prioritizing self-care, family members can better cope with the stress and challenges of living with an addict while maintaining their own healthy lifestyle or their own health and well-being. Okay, next slide. That is just a few, as I mentioned, CODA and Anon that you can research if you want to join a support group. Okay. Lastly, I've mentioned, well, I put insert this picture into this presentation tonight because it goes about expectations. So usually what happens is families or loved one, they hold this unreasonable expectations, just as with the first arrow. So everything is going to be smooth sailing from here. And in reality, it looks more like in the picture. There's going to be ups and downs. There's going to be challenges. So old unreasonable expectations. Ellie, can you still hear me?
Yes, we can hear you.
Okay. Many loved ones find themselves disappointed by a recovering addict and the progress that they've made or haven't made. This is especially true when it comes to relapse. And then assess your expectations. What does the expectation mean to me? How does this relate to my codependency? That is then the end of this presentation from my side. What is going to happen now is we are going to open the floor for any conclusions. I read conclusions, sorry, for any questions and answers. I'm not sure, Ellie or Cheryl, if you would like to include something that I just mentioned or make a comment on some of the slides.
Right. Thank you so much, Marlé. I think that was really insightful. We do have a question in the chat box. Kurt is asking, how are you supportive and compassionate without being a victim to manipulation of the addict?
Sorry, I just want to open the question myself so I can read it.
Yeah, so I think he's asking, how can you support, someone in recovery and show compassion without becoming victim to their manipulation?
Yes, Marlé, if you don't mind. And I think this is such a good question. You know, listening to the presentation, can you guys hear me okay?
Yes, we can hear you.
Okay, you know, listening to the presentation, and you know, we talk about in our industry, we talk about unconditional positive regard. And what does that mean? That means that we treat your loved ones with unconditional positive communication, respect, and yet they still try and manipulate us. And they will definitely try and manipulate you. So from my experience, I think it's about being really wise to know that the manipulation is part of the disease of addiction. And I can still be kind to you, but what does that look like? So is that kindness? I'm treating you with respect. I'm setting healthy boundaries, and then you ask me for 50 Rand, and I say no, then you throw your toys out the cot. So it's a tough one. And I think it's about sticking to what your boundaries are and always check your motives. We as the family need to check our motives. And what is our intention? Because I think if we're very honest with ourselves, our intention is we think if we change, they'll stop using. They'll get better. And that's not why we treat them with respect. We treat them with respect because maybe we're respectful people. And we treat them with respect because they're still our loved ones. They are children. But I can respect you, but I don't have to believe everything you say. So, for example, in the treatment center, we get manipulated every minute of every waking hour. And we check. We check with you, we'll call you, we'll send texts. We on groups. We have our own WhatsApp groups amongst the staff, because I might be in the office and I've said no to somebody, and they'll go out and they'll say to Tristan or Marlé or Lolly, Cheryl said that I can phone my mom. And my team just pops me a text and say, did you say it? And I'll say no. Then we know we're being manipulated. So it's about expecting to be manipulated and not getting upset with them when they do, but also not capitulating. And it takes time, and it takes hard work, and it takes a lot of self-reflection to get to that point. But I think to start off with, accept they're going to manipulate. They don't hate you. It's not about us. That's what the disease of addiction is made up from. Lying, deception, manipulation, easy, quick fix, easy route, cutting corners, making their life comfortable. So I think that's a great question, but not that easy to answer. Marlé, I don't know if you really want to say something.
Absolutely. Absolutely. And I think it's important that you identify your boundaries, you express the boundaries, and to also assert the boundaries. We found that a lot of times their support system have overly flexible boundaries, and once Those in recovery can see that my parent or my partner is overly flexible. They continue to manipulate because they find a loophole. So it's very important to identify the boundary, to express the boundary, but also to remember to assert that boundary. It's not an easy process, like Cheryl said, but one needs to be assertive when it comes to honoring those boundaries. All right, we do have another question. Someone is just asking, what is the name of the book you mentioned at the beginning of the presentation? So I think there are two books that were mentioned.
Yes, so the first one was the big book of Alcoholics Anonymous. So yeah, that's a big blue book, as I mentioned. We call it the big book of Alcoholics Anonymous, and the chapter there that I focused on was the doctor's opinion. Okay, so that was the first book. And then the second book that I spoke to was Melody Beatty's Codependent No More book. That is more a book that offers practical tools and insight and guidance for families.
And she's got a whole series of books.
Mm.
She's on Facebook. She's got some nice short daily readings. So it's definitely worth checking her out.
Yeah, absolutely. I mean, still on the topic of boundaries, Kurt is asking, what are the realistic consequences to boundaries?
Okay, Kurt, you're on a roll tonight. Stump the panel. Again, I think I could start. I think it depends on where you're at with your own particular loved one. Boundaries shouldn't be. Remember, there's a difference between a boundary and a rule. So I think each of us have rules in our home. And, like one of the rules maybe in my house is whoever goes to bed last has to lock the door. If they don't lock the door, what am I going to do? Am I going to kick them out? Am I going to take away supper? What am I going to do? So generally speaking, for those kind of rules, we'll say, you know what, you live in this home, you need to participate, lock the door. And if it keeps happening, then I have to set some consequences. I think boundaries, we had such a lovely workshop, I think 2 weeks ago. And it was, I think we started off by saying a boundary is where do I begin and where do you end? So I think be aware of what our boundaries are versus what our rules are or our contracts. And the consequences need to be realistic and attainable. That's the most important. If you can't stick to them, don't say them. So many of us say that, we'll kick you out or I'm not going to pay for anything. That needs to be something you're so sure that you can stick to. So I think maybe for more realistic guidance on that, please speak to your loved one's counselor. And if they're not in treatment right now, you're welcome to text me or pop me an email and I'll help where I can.
Absolutely. Thank you, Cheryl. I think also just to add, it's important that the consequence has impact, because what's the use if the consequence doesn't have impact? Sometimes we might think sending them to their room or isolating them is a consequence, but for them, it perpetuates the addiction. So it's very important to always think about impact. So, because we sit with a lot of questions, and I think this space is important, and it's a gentle reminder that we don't have to just sit with those questions in isolation. There is room for support. There is room to get answers. And we're essentially collaborating in the space. So if anybody has just one last question before we close.
I think before we get a question, I just got a direct message that Laurelie Rosano, she's very active on Facebook. She's also written a book called Jagged Little Edges, I think. And she's published a book for children. It's called Gracie's Secret, and it's for ages 4 to 8. So if you've got children whose parents are addicted, if you've got children in the home where there's an uncle and aunt, a sibling who's older, who's addicted, it might be a good idea. Laurelie's got the most incredible insight around addiction and recovery. She's a recovering addict herself, and very active in treatment and support. And I think that's what it's really about for us, is getting that knowledge. What I loved about, Linda, what you said, is being aware. How many of us would have gotten to the till, been irritated and thought it's because it's Saturday afternoon, I'm tired, it's hot, there's nobody else, people in my way. But to know that I'm irritated because I've bought the stuff before, it's actually not my responsibility to be doing it. And I'm carrying a resentment. And then if you were in a 12-step program, you would go and do a mini 1 step, 2, 3, and 4, so that you can work through that resentment. So I think that self-awareness and self-care comes in with us as family members more than you'll be aware. You might think every once a month we talk about self-care. And I know for myself, when I first went into support groups, I didn't want to hear about self-care because that's not going to solve my problem. I want to know what to do with the addict. Please, he's driving me mad. He's using, he won't go into treatment. He's destroyed my house, my family. Are you going to tell me to take a bubble bath and go for a walk? Crap, I'm not buying that. But when we start doing that, the addict loses their dominance in our lives. And believe it or not, they start picking up on that because they need us to be focused on them. That's one of the symptoms of this disease. And when we take the focus away and start looking after ourselves, and it's not just bubble baths, it's where and how we spend our money, saying no, to tuck. This is something, if you've got your loved one in treatment with us now, from our whole team, don't keep an open wallet when it comes to tuck. Check with the counselors what we recommend, but we don't recommend probably more than $4.50, and that's a lot of money per week. And that's for what? Chocolates, chips, and cigarettes. It becomes very expensive. Then they start with, oh, I'm stopping smoking, please can you buy a vape? And then the parents go, oh, that's great, because then we'll buy a vape. But then what they're doing is they're taking 1 box of cigarettes a day, they're smoking their vape, and they're still taking a chocolate. Don't be afraid. Say no. That's self-care. That's setting healthy boundaries. And I think because of tonight's workshop, what stuck out for me again is the value of attending these workshops, these presentations and support groups for as long as you need us. There will always be something that you need an answer to, and you may not even know the question. But I've been involved since 1983 in family support groups, and I still learn something every single day from my clients, from my colleagues, from their families, because this disease is that complicated. So sorry, I just had a little jump in.
No, don't apologize, Cheryl. I think we needed to hear that because self-care is more than just sitting in a lotus position and taking deep breaths. It's about doing the inner work as well. So that was really valuable.